If you've been diagnosed with hip bursitis, also known as greater trochanteric bursitis, in this video, I'm gonna give you 3 tips that you can use that will immediately reduce your pain other than just taking anti-inflammatory medications and just resting. Tip number 1 is you want to reduce the pressure on the bursa, so that painful part on the outside of your hip. Essentially what happens is that bursa that sits along the outside of that bony structure, it gets inflamed, it gets super irritated. So you want to reduce as much pressure or stress on that area as you can. So what that looks like is the first thing that you want to do is whenever you're lying down, whether you're sleeping on your side or on your back, you just want to make sure that you're avoiding lying directly on that side. That's the most obvious way that you reduce direct pressure on that bursa. But some other things that you want to avoid are wearing very tight clothing. So whether that's jeans, tights, or even like if your belt is a little lower on your waist and you're kind of compressing that area too much. Most people aren't wearing their belts that low, but some people I found that if they're wearing their pants lower and they tighten up their waistband with a belt and it's sitting right on the outside of that bone, that definitely causes direct pressure on that bursa, which inflames it even more. So anything where you're lying on your side, you're putting something on that area that may be compressive, very tight on the bursa, you want to reduce that as much as you can. So wearing looser clothing, sleeping on the other side, and just making sure that you're giving that area, that side of your hip, as much relief from direct pressure as you can. Tip number 2 is you want to use some kind of cold modality or cold therapy. So with hip bursitis, essentially it's just inflammation of a bursa. So on the outside of your hip, that bursa is just inflamed, right? There might be increased swelling and it's just very irritated. So in terms of determining between hot versus cold modalities, heat is definitely going to help with increasing your vasodilation, improving your circulation to a certain area, but that's not necessarily what we want. At this stage, especially with how much inflammation we have, we want to bring that down. So using a cold therapy, a cold modality is going to do just that. So with a ice pack or a cold pack, you want to apply that to the outside of your hip, and doing 15 to 20 minutes is plenty in terms of time at one given time. But ideally, if you can do that multiple times a day, that's going to help bring that inflammation down even further. So when determining cold versus ice, you want to lean on the side of doing like cold modalities for hip bursitis. All right, the third tip is we talked about how direct pressure on that bursa is going to cause it to become irritated, but also if you put too much strain or stretch on other structures around your hip that compresses the bursa as well, that also will increase the inflammation. So for example, on the outside of your hip, you have soft tissue, you have connective tissue that will tense up. So for example, you have your IT band, your TFL muscle that if your legs are, for example, crossed over, that's going to tense up the outside of your hip if you're crossing your legs. And because the bursa sits underneath of some of those structures, that tension will cause that bursa to be compressed underneath, which will irritate that bursa even further. So for some people, if you have the habit of when you're sitting down, you cross your legs, ideally, you want to uncross the legs, sit in a more neutral position with your hips and your legs. Or maybe when you're standing, you're standing for a longer period of time, so maybe longer than a few minutes. Some people don't notice that they'll end up shifting their hip one way and they'll hang out there for an extended period of time just because for the body, it's just naturally easier and more efficient just to kind of like hinge to one side and then just hang out there. But like I said, that also puts unnecessary and excess tension on the outside of that hip. So if you're standing around, whether you're outside at the grocery store or you're just standing at home for a longer period of time, ideally try to pay attention to how your hips are when you're standing, making sure you're not leaning or shifted to one side. Try to stand up fully upright or, take sitting breaks so you're not standing too long. All right, guys, hopefully that video was helpful. If you have any other questions about hip bursitis or any other types of injuries, please leave a comment down below as I'll try to get back to it as soon as I can, and I'll see you in the next video.